I'm going to wash my hands, and when I enter, I'm going to introduce myself. Hi, I'm Samantha. I'm the HAC student nurse, and I'm going to be doing a heart assessment on you today.
Okay.
Can you please verify your name and your date of birth?
Tammy L. Markey, 6/17/63.
And do you have any allergies?
No, I do
Okay.
not.
Okay, thank you. So before we get started, I'm going to pull the curtain for privacy,
Okay.
and I'll make sure that you're safe throughout. So I'm just going to start by asking you some questions about your heart and past heart health and family history. Can you tell me a little bit about your diet?
It's pretty healthy. I eat lots of fruits and vegetables. I try to eat lean meats. I try to avoid carbs as much as possible. And I have an occasional glass of red wine.
Okay, great. How's your exercise regimen?
I exercise 4 to 5 days a week. I run. I do some weights. Yeah.
Sounds good. Are you currently having any chest pains?
No.
Anything recently?
No.
Okay. No feelings like your heart's racing or any palpitations?
No.
Okay. And do you have any family history of heart disease
No.
or complications?
No.
Okay, awesome. So I'm going to go ahead and just take a look first, and we're going to inspect the chest. So normally if we were in the clinical setting, we would be able to see the bare skin here as well. And I'm going to look at the thoracic cage to make sure it's symmetrical. And it looks like it's symmetrical, and the skin color is appropriate for the patient. There's no lesions. All right. And I'm not seeing any retractions under the clavicle, which is good. And I'm not seeing any pulsations at the apex of the heart. So next I'm going to auscultate. So I'm just going to take a listen.
Okay.
And we're going to start at the right sternal border, at the second intercostal, listening to the aortic site. And then the left sternal border, again the second intercostal space, and this is the pulmonic site. And then we're going to move down to the third site, the third intercostal space. This is Erb's point, and here we would assess the heart rate for 30 seconds. Good. We're going to come down to the fourth site, which is the tricuspid site at the fourth intercostal. And then the fifth site is the mitral site, and that's going to be at the midclavicular line. All right, awesome. Everything sounds good. I'm going to go ahead and just palpate those areas,
Okay.
and if you have any pain, let me know, or any tenderness.
Okay.
And with this, we're just, again, looking for any pain or any lumps that we might feel. Okay, no pain with that?
No.
All right, and then lastly, we're going to just feel the carotid arteries on both sides one at a time. And they feel strong, steady, and symmetrical on both sides.